Thank you. Thank you, Dr. Ted. Thank you, Joanne. Thanks, Kay, for inviting me also to be a part of this roundtable. So I'm Robert. I work for Unitaid. Unitaid is a development financing agency that invests in cutting-edge innovations, treatments, preventives, diagnostics for the leading infectious diseases that most low and middle-income countries are contending with. So by that, I mean HIV and co-infections, TB, malaria, but more recently also broader women's and children's health issues and indications. So we're also heavily invested in cervical cancer screening and secondary prevention, fever management among children. Central to our investment model is, taking bets on products in the pipeline, whether it's a treatment or a diagnostic or preventive, to accelerate their advancement through that pipeline and then actually introduce them into resource-limited settings in a way that sets up governments and their partners to be able to ultimately use and scale those innovations. And more recently, we want to understand a bit better how we can partner with non-traditional investors. So up to now, our investors, those donors that fund the work we do, are governments, our foundations, but increasingly, we feel we do need to expand our approach to supporting the introduction and positioning for scale of these innovations, and therefore, it's really useful to be a part of such roundtables to understand what other types of investing might make sense for an entity like Unitaid. We are part of the public sector, but we partner, extensively with the private sector because that's how we structure the deals and negotiations we have for introducing these technologies. And we invest across the access continuum. So we invest in the evidence that's required, whether it's clinical evidence, whether it's feasibility of implementation evidence, and so on, as well as in the actual technologies themselves, whether it's catalytically procuring them, introducing them at pilot scale, then positioning them for even greater scale, and then brokering with governments how they might then include them in financing packages, whether it's with the Global Fund or with a big bilateral like PEPFAR, maybe it's an HIV treatment or diagnostic. But we feel there is scope to do even more if we can find, investors who are interested in this model and approach that we take. Because in essence, just building on what you said, we are able to de-risk substantially whether an innovation is going to take off or not by recovering the evidence gaps, by positioning the product for further introduction through the pilots and clinical experience we have with the governments we work with, and so on and so forth. So we feel there is a ripe market and opportunity to open up the financing approaches than the traditional ones. And that's even more important because we can't continue to rely on traditional ODA or foundations to underwrite this cutting edge work, because resources are, as you've seen, more and more constrained, whether it's COVID, whether it's global crises like we're seeing in Ukraine. There is just less of the traditional type of financing out there. And there's plenty of other financing out there, but the approaches to work with entities like ours are not well understood. But the language of impact investors and what makes sense for them, particularly if the return is not simply the bottom line, but also looking at economic savings for programs on the global response and looking at life saved or well-being, where we have partners like that, it makes sense. And so we very much understand your language, you speak your language, but we haven't yet branched into a space to start to potentially contemplate partnering. So this is more putting it out there that, entities like Unitaid are out there. We're happy to explore further alternative financing mechanisms to the ones we traditionally rely on, particularly because I think there's a sweet spot in that Venn diagram where what makes sense for you makes sense for us, but it's about starting that journey. Thank you.